Welcome to our video on gastrointestinal manifestations, or the gut, how it's affected. This disease can cause scarring in the muscles around your GI tract or gastrointestinal tract or your gut, making it difficult for the passage of food all the way through your tract. Many patients suffer with issues such as acid reflux, sometimes difficulty swallowing, bloating or constipation or diarrhea. So what we call dysmotility, difficulty in motility of the gut. And these can all be signs that the gut is involved in systemic sclerosis. It can affect anywhere from the mouth all the way down to the anus. And this disease can cause dry mouth, as I've said, acid burning, difficulty swallowing, bloating, constipation, diarrhea, and sometimes even incontinence of stool. There are many things that you can do to help yourself. For acid reflux, for example, you can not eat late at night. You can give up smoking. Getting the head of your bed up by 4 to 6 inches makes a huge difference, because if you're going to reflux at night when you're lying flat, guess where the acid spills? Spills into your lungs. Bit of a disaster. So try to get the head of your bed up. Avoid caffeine, avoid meals late at night. For SIBO, or it's called small intestinal bacterial overgrowth, where the food just sits beautifully in your middle of your gut, and it sits at 37 degrees, and the bugs just love it, and they go crazy, and they cause lots of gas, and that can cause bloating. So for that treatment, you can try probiotics. There's no great evidence for that, but I suggest to my patients that they can try them for, say, a couple of months. And if they're helping, they can do that. Again, eat small meals, try not to eat late. And for the bloating, constipation, diarrhea aspects of this, avoid foods that make that worse. We have medications that can help with many of these aspects. But first, we always like to get the patient to see what they can do for themselves and figure out their dietary manipulations to see if that can help as well. So that wraps up our video on gastrointestinal involvement. So that's the end of our series of videos for educating patients and their carers on the condition systemic sclerosis or scleroderma. We really value any feedback. And I've given an email address here for feedback to these videos. And I'd also once again like to acknowledge our sponsors, Merck, the Hamilton Scleroderma Group, and Scleroderma Canada. Thanks very much.